Welcome to the Public's Health. I'm Dr. Tony Iton, Alameda County Public Health Department Health Officer, and this show is a production of the Alameda County Public Health Department. Our mission is to put the public back in public health. Today we have two very exciting expert guests to talk with us about influenza. On stage with me now is Dr. Nathalie Bera, the Deputy Health Officer for Marin County. Welcome, Nathalie.
Thanks for having me.
Nathalie, can you tell us a little bit about what influenza is? Give us a sense of what kind of disease this is.
Yep, sure. It's a contagious respiratory illness, and it's caused by influenza viruses. And these viruses can cause mild illness or severe illness, and sometimes can lead to death. Every year, millions of Americans, approximately 5% to 20%, are affected by influenza.
Wow.
And it causes about every year 200,000 hospitalizations and also about 36,000 deaths.
Well, that's a lot of cases. What are the symptoms of influenza?
Yeah, people will often feel just very ill. They'll have a fever. Sometimes it's very high, a lot of muscle aches. They feel very tired, also sore throat or runny nose. They can have a cough sometimes, a dry cough, and sometimes stomach symptoms like nausea and vomiting, diarrhea, although these tend to be seen mostly in children than in adults.
And how long does this illness last?
Usually it's about a week to 2 weeks, so that's about usually how long it is.
Wow, so that's a pretty long duration.
Mm-hmm.
Now, how is it transmitted? Is it transmitted from person to person?
That's a great question, important one in terms of when we talk about prevention too in public health, but it's transmitted via respiratory droplets. So for instance, when someone sneezes, then it can be passed on to another person that is in close contact with that sneezing person. The other way is if the sneezing ends up on an object in between, and then another person comes along and touches that object and places their hand in the mouth or nose, then the respiratory droplets can be passed on that way too. So a couple of ways primarily that it's transmitted.
Oh, interesting.
Mm-hmm.
Now, what's the incubation period? If I'm exposed to influenza, how long does it take for me to actually start to get sick?
Yep, it's about 1 to 4 days between the time a person's exposed to the virus via these respiratory droplets, as we talked about, until they then start to show these symptoms that we've talked about. Fever and the aches and just feeling tired and ill.
Now, can I transmit the disease before I start feeling ill?
That's a great question, an important one. Yes, unfortunately, about a day before, as early as a day before of getting symptoms, a person can transmit the virus to another person. And that can last, that ability to transmit the virus can last up to about 5 days after they get the symptoms themselves. So it's a fairly good length of time where they can transmit the virus to others.
Well, that's a pretty good recipe for transmission. Now, what about some of the complications of influenza? Can you tell us about some of those?
Yeah, one of the most concerning ones is the affecting of the lungs. And so one of the complications is pneumonia or severe respiratory distress. For people that have asthma, they can get a worsening of their asthma. And sometimes people with existing chronic conditions like heart or lung can have worsening of their heart status, congestive heart failure, or worsening of diabetes, for instance. And then with children, they can also often get ear infections related to having influenza.
So how do doctors treat influenza?
There are some medicines called antiviral medicines that are available to treat influenza. Those are given primarily to people that have a higher risk of getting complications like pneumonia or ear infections.
Okay.
Yeah.
Thank you. We're now going to roll to some images of a flu vaccine clinic.
My name is Leslie Greenwood, and I'm the immunization coordinator for Alameda County Public Health Department, and we are at Mastic Senior Center today, where we're holding a mass flu clinic. for seniors. You're seeing costumes because today's Halloween, and actually I thought about putting on black wings, but I figured I'd scare too many people away if I did. The way the process works is that they usually come in and they sign the authorization record. They go through a talk on the flu vaccine. We do a preliminary screening with them about egg allergies and Guillain-Barré syndrome, and then they come through each of the stations and they're immunized. There is no cost, it's free. Mastic Senior Center puts this on together with us. They take donations from people, and what happens is once all the donations come in, the money is divided up between immunizations and Mastic Senior Center. And we usually use that money to purchase vaccines for the elderly for next year. It's very important for seniors to get their flu vaccine because every year in this country, 36,000 people die from the flu. And certainly the elderly population is the one that we want to protect, as they have the second highest mortality rate after infants for complications from flu. We have a group of public health nurses that are here giving the injections, and we also have students from Cal State Hayward and the immunization staff itself. Having the health officer do the media interviews, talk about the importance of getting immunized, talk about other measures that can be used to prevent the spread of flu is one very important way that the news can get out. I would advise people to take very good care of their health during flu season, to eat well and sleep well and get enough exercise. I would ask that people who had colds would stay away from groups of people. I would suggest that if they did have colds, that they certainly be using tissues to sneeze into and throwing those tissues out, and that they be doing a lot of hand washing. Hand washing is probably the single most effective measure to use to prevent the spread of flu.
To try to get high-risk people vaccinated. What are some of the other things that people can do to avoid getting the flu every flu season?
I'm really glad you asked that question, because it's one of the simplest things that people can do, which is to wash their hands, especially before they eat. And washing 10 to 20 seconds running under the water and soap is really important. Sometimes people can use alcohol-based gels too. So that's one way. And the other thing is to, when at work, avoid close contact with workers that seem to be ill and may be having the flu. So those are a couple of things. Also, avoiding touching your nose and mouth is helpful during the flu season, because if you do pick up some of those respiratory droplets, then you can prevent passing them on to yourself.
Well, we've just seen the vaccine clinic. Who should be vaccinated during the flu season?
Those are high-risk people, as you mentioned before, and there are several groups that fall into the high-risk category. One of those is adults that are over 65 years of age. And also another group are adults that are living in skilled nursing facilities in close quarters with each other. Adults and children over 6 months of age who have chronic medical conditions, whether heart disease, lung disease, or diabetes, for instance, should get vaccinated. And then also pregnant women and young children aged 6 to 23 months old are some of the higher risk groups.
And we've heard a lot about these antiviral medications. How do these fit into the mix? Who should use those, and how do they get used?
Yeah, the antiviral medications are also indicated for people who are at higher risk of complications. So again, those who are older adults, also the very young children. And so it's important for people who feel like they may have the flu to go and speak with their healthcare provider about possibly getting a prescription for antivirals, because they should be taken within the first 2 days of having symptoms of the flu. So it's important to get to their healthcare provider as soon as possible once they think they have that.
Now, are there enough of these antivirals around for people to get them when they need them?
They're certainly in the news lately. There's been stories about not having enough of a particular antiviral called Tamiflu. And so there's a lot of news stories about that. But at this point, there have been a lot of alerts issued to healthcare providers about using the antivirals carefully and cautiously for those who are most in need. And so we do feel confident that the provider community is aware of this issue and aware that they need to save the antivirals for those who are really at high risk for the complications.
Now, you're the Deputy Health Officer in Marin County. What's Marin County doing to prepare the citizens of Marin County for influenza?
We do several things, and I guess you could say several categories of activities. One of them, a main one, is education. We do education to the public with, we have a very extensive website. We also have a warm line that has influenza information, and it's both in English and Spanish, also in Vietnamese. And we answer questions. Our public health nurses answer questions regularly. We also do education to the physicians to let them know about updates in influenza. And then another major activity is procuring vaccine from the state health department and administering it, delivering it to our key healthcare partners, like, for instance, the homeless centers, centers with mental health and substance use patients. So those are some of the main things we do, as well as surveillance for influenza.
Great. Well, thank you very much for being with us, Dr. Bera. We're now going to talk to some people on the street, and we're going to move to the subject of avian influenza, which is something that has been on the minds of a lot of people lately, and we want to hear what the people on the street have been hearing.
I heard that it's very contagious and that people actually die from it.
I've never heard anything about a bird flu.
I've heard a little bit.
I heard a little bit on the news.
I know it's given off from some type of bird.
Sounds like it's still within the bird population and hasn't really mutated to anything that could be spread quickly to people.
They're dreading that it's going to come to the United States.
I know that it's been a lot of talk about the threat of it coming from Europe into the United States.
That it's dangerous.
Everybody is warning that we should all stay very aware.
Growing every little disease you got to pay attention to on the news.
It is a cause for concern. I'm concerned about it.
It could be coming closer.
Yeah, in Asia that it started there, and somebody playing with some chickens and birds are getting contagious.
More and more we hear on the news about how airports are concerned because if somebody who's just even slightly sick gets in an airplane and you're stuck in an airplane with somebody all the way over here, and then by the time they reach here, a whole plane load of people could be sick, and then it just grows like crazy.
Especially in this area because they have so many people that are coming in from the nations that where it's going on. So it's kind of scary to think that it could get closer to home.
I know that animals carry diseases, but it never dawned on me that there would be a disease called or known as a bird flu.
We're now joined by Dr. Robert Benjamin, the Deputy Health Officer for Alameda County. Welcome, Dr. Benjamin.
Thanks.
Avian influenza. We've heard all kinds of things. Avian influenza, pandemic influenza, regular influenza, shortages of vaccine, shortages of medication. Help us navigate this a little bit. What are the distinctions between avian influenza, pandemic influenza, and regular run-of-the-mill influenza?
Well, we'll start with the regular run-of-the-mill influenza because that's the one that everybody's really familiar with. It is the illness that Dr. Bera just described. The difference between the run-of-the-mill influenza, as you put it, and pandemic influenza is that in order for the virus to become pandemic, to become basically worldwide and global, it has to be a very new virus, one to which the human beings have not before been exposed. It has to be transmissible person to person, and that's key here. And then when those conditions are met, brand new virus, nobody's immune, and it's transmissible person to person, then and only then can it become and be called pandemic. Avian influenza is a very specific influenza, causes the same kind of respiratory illnesses and death in birds, but not at this point in humans.
So on that note, how is avian influenza, which is clearly spreading in parts of the world, how is that currently being transmitted?
Well, the thought is right now that birds who are infected with avian influenza get sick, most of them, not all, shed the virus in their droppings. This contaminates the water the water and environment in which other birds exist. They then become infected and then transmit it on to other birds. The problem with this particular one is that this is currently a disease in poultry, but it is now crossed over and infected wildfowl and shorebirds that are migratory. And so this is how this disease is now spreading from one country to another.
So primarily what you're saying, this is a bird-to-bird illness, and despite that, we've heard about some human cases of avian influenza. How is that happening?
Well, the Centers for Disease Control, the World Health Organization have been very interested in this particular question. Right now, and as of 10th of November, there have been 124 cases of avian influenza in human beings. There have been hundreds and hundreds of thousands, if not millions of cases in domestic poultry. So what happens is people who are in direct and very, very close contact with infected birds are the ones that, at least at this point, are becoming ill. This has not yet been confirmed to prove to be person-to-person transmissible. And that's a key in this definition of what is pandemic influenza.
Wow, so there's some interesting things going on. This is a dynamic disease, and we're watching things develop over time in different places. Well, we're interested in hearing what the man on the street has to say about these kinds of things. In your comings and goings, have you heard people explaining this concept on the street in a way that's coherent, or is it more sort of fear and concern?
Actually, there's a bit of both. There are some people who have educated themselves very well, and others who need a little more education.
Okay, we're going to go now to just some people on the street and find out what they have to say about avian influenza.
I don't know exactly what questions to ask.
Lots of questions, because it sounds like that it's more, as it's covered more in the press, there's more questions than answers.
Why did it get started in the first place?
Is it contagious for people?
How do you know that you have it, and what are the symptoms?
How was it able to spread like this?
What is being done
What are they doing about it?
to either deter it or eliminate it?
If it'll quickly come here.
Whether or not they're really being successful on developing a vaccine,
What type of viruses and vaccines are being developed?
and also whether or not they're going to have enough to go around.
Will they have enough vaccines?
My questions are just what else we can do, because so far it seems like all the words, all the recommendations we're getting have been sort of either lame or common sense, like wash your hands and things like that.
What type of preventative measures are they taking?
Who's responsible?
I understand that the president made a recent speech regarding it.
Are they helping?
All we have are just our basic reassurances that to feel safe.
You know, who's going to take that action?
But that's still, I don't know, it still leaves you with questions.
Make sure they get it to the masses, and that it, in terms of how it's going to be distributed. I want to make sure I get my shot.
So a fair amount of confusion out there, some legitimate questions about what is this bird flu. Dr. Benjamin, let's start with where has it been detected thus far? And I believe we have a slide that our producers can put up on the screen to show some of the spots where avian flu has been detected thus far.
Well, it was first detected in Asia. It cropped up in Vietnam, in Indonesia, and China, and has actually fairly rapidly spread westward through Central Asia into parts of Europe, and most recently has been detected in birds in Canada.
Wow, so rapid spread, presumably through migration of these wild birds with spread to domestic birds on the ground in these areas?
Basically, that's it. The migratory patterns of these waterfowl and shorebirds are such that they travel great distances, and given that this particular avian influenza is highly transmissible and highly pathogenic in birds, we've seen this spread. There's some differences, though, in the way birds are kept in most of the world and in the United States and in parts of Europe. Commercial poultry farming in the United States, anyway, is mostly done, except for free-range chickens, in shelters. And these birds really don't have contact with the wild fowl that might be infected. So in that regard, the spread to domestic chicken flocks may be less and may not even happen at all, at least in commercial flocks.
So bird to bird, migratory birds are spreading this into new countries every week, every month, but still not really a human illness. Now, should it become a human illness with significant human-to-human spread, what kind of tools do we have to protect ourselves from avian influenza? Is there a vaccine?
Well, not yet for humans. There is a vaccine that's currently being used for poultry in order to protect poultry flocks, and in so doing, if you can protect the flock, then you can protect the people who work with those birds. One of the problems with developing a human vaccine is that we're not yet sure what this virus is going to look like in a form that will be transmissible from person to person. Right now it's not transmissible person to person. We know what that virus looks like, but influenza virus is, I don't want to say clever, but has adapted and evolves, and so it changes its protein coats. So until we identify a virus that is readily transmissible person to person, it would be very, very difficult to make a vaccine that would work.
So a moving target, in essence.
The virus is. But there are, your question was, what else can we do? There are things that we can do. Dr. Bera talked about education, talked about people recognizing what the signs and symptoms are of an influenza. And this is an influenza basically like any other, except when it does hit people, for the moment anyway, it has a very, very high mortality rate, a high death rate. Personal hygiene, respiratory hygiene. Cover your coughs, cover your mouth, use tissues, dispose of them properly, wash your hands thoroughly, and if you're sick, don't go to work. Don't go to school. You really want to stay home, both because you're going to need the rest. One of the symptoms my grandmother always told me of influenza is you really feel like you've been hit by a Mack truck. Mm. You need to hydrate, you need to not transmit to other people.
Very good advice. So in essence, we're talking about good hygiene, being aware of the symptoms of influenza, and being in contact with your physicians when necessary to get the best and most appropriate advice.
Yes.
Now quickly, would you be able to tell us what are counties doing to prepare their citizens for this?
Well, again, Dr. Bera began and actually stated very well what Marin County is doing, and this is what all counties are doing. Education of population, education of healthcare providers, increased surveillance, and planning to deliver either vaccine when it becomes available or antiviral meds if, in fact, they too are available.
Well, thank you very much, Dr. Benjamin, for being here, and I'd like to thank Dr. Bera as well. Next week we're going to be talking, or next show, excuse me, we're going to be talking about depression and eating around the holidays, and we hope that we can get public input into the subjects that you would like to hear about on the public's health. This is your show, and you can contact us through the Alameda County Public Health Department, 510-267-8000. Thank you very much.
Hi, my name's Linda Meldman. I'm a community health nursing instructor for Cal State Hayward, And I have here today two of my nursing students, Melissa Timmons and Samantha Russell. And we are going to give flu immunizations, because now's the time to have a flu immunization, to 2 adults who are at risk because they have direct patient contact.
You ever had a flu shot before?
Okay, 3 questions
I have had one.
for
Have
you.
you had a negative
Are you
reaction to
allergic
it?
to
No
eggs?
problem.
No.
Are you
Have
allergic
you
to
had a flu
eggs?
shot
Eggs?
before?
No.
And have you
And
had a?
have you ever had
you haven't had a flu shot.
No.
Okay.
Okay.
And have you ever had Guillain-Barré?
No.
No. Okay. Let's find the landmark. Okay. Go ahead and relax your arm. Just clean the area. Just go ahead and relax your arm for just a moment. Nice and relaxed.
That was great. It didn't hurt.
There you go.
Thank you very much.
You're welcome.
Thank you.
You're welcome.
And that's how you have a flu shot.